Your prostate does not have to keep growing. 5 specific foods can actually shrink it. Not just slow down the enlargement, actually reduce the size of the tissue. I am Dr. Max, practicing urologist for 15 years. I have helped hundreds of men avoid surgery with these 5 foods. The food at number 1 contains more beta-sitosterol than any prostate supplement you can buy. That is the compound that blocks the hormone making your prostate grow. But here is the critical part. These 5 foods work together in a specific sequence. Each one prepares your prostate for the next. Let me explain how this process actually works. Here is what happens inside your body. Your prostate grows because of one specific hormone, dihydrotestosterone. As you age, your body converts more testosterone into this growth hormone. It tells your prostate cells to multiply. More cells, larger prostate. That growing tissue squeezes your urethra like a fist closing around a garden hose. The result? Weak stream, constant urgency, waking up 3 times a night. Now here is the part most men never learn. Prostate medications do not actually shrink the tissue. They relax the muscle around your prostate or block some hormone production. Your symptoms improve, but the prostate stays enlarged. These 5 foods work completely differently. Let me explain exactly how they reverse the growth at 3 critical levels. Level 1. These foods block the conversion. Remember that hormone I mentioned, dihydrotestosterone? Your body makes it by converting regular testosterone. These foods contain compounds that stop that conversion process. Less dihydrotestosterone means your prostate cells stop getting the signal to multiply. The growth slows down. Level 2. They reduce inflammation. Think of inflammation like swelling after an injury. Your prostate tissue stays puffed up, pressing against your urethra. These foods contain natural anti-inflammatory compounds that bring that swelling down. The pressure decreases. Urination improves. Level 3. They trigger something called apoptosis. That is the natural death of damaged or excess cells. Your prostate has been growing too many cells for years. These foods activate pathways that tell those excess cells to die off naturally. The tissue shrinks, not just stops growing, actually gets smaller. 3 levels working together. Block the growth signal, reduce the swelling, eliminate the excess cells. Now let me show you the 5 foods that do this, starting with number 5. Pumpkin seeds. Here's why we start here. Pumpkin seeds contain 2 compounds your prostate needs, zinc and beta-sitosterol. The zinc reduces inflammation in prostate tissue. The beta-sitosterol blocks that hormone conversion I mentioned earlier, testosterone to dihydrotestosterone. Less conversion means less growth signal. A German study followed 214 men with enlarged prostates for 12 months. One group ate pumpkin seed extract daily. The control group did nothing. The pumpkin seed group showed 41% improvement in symptom scores, better urine flow, fewer nighttime bathroom trips. Here's how to use them. 1/4 cup of raw pumpkin seeds daily. Raw, not roasted, not salted. You can eat them as a snack between meals. Toss them on salads. Mix them into oatmeal or cottage cheese. Grind them and add to protein shakes. The key is daily consistency. Most men notice better sleep within 3 to 4 weeks because they are not waking up as often at night. Pumpkin seeds set the foundation. But number 4 is where the real shrinking begins. This next food targets prostate cells directly. I want to give you something that can make a real difference starting today. I have created a complete guide for you. 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. Number 4. Tomatoes. But here is the critical detail. They must be cooked. Raw tomatoes contain lycopene, the compound that shrinks prostate tissue. But cooking breaks down the cell walls and makes the lycopene 10 times more available to your body. 10 times. This matters. A Harvard study followed 47,000 men for 6 years. Men who ate cooked tomatoes at least twice weekly had a 23% lower risk of prostate enlargement compared to men who rarely ate them. Lycopene blocks signals that tell prostate cells to grow. Here's how to use them. Tomato sauce over pasta. Roasted tomatoes on chicken or fish. Tomato soup. Shakshuka for breakfast. Add tomato paste to stews and chili. The key is heat and healthy fat. Cook them with olive oil. The fat helps your body absorb the lycopene even better. But tomatoes work best when paired with number 3. This next food amplifies everything. Number 3. Green tea. Here is why it amplifies everything. Green tea contains a compound called epigallocatechin gallate. This compound does 2 things. First, it enhances the absorption of lycopene from those tomatoes you just ate. Second, it protects the compounds from pumpkin seeds so they last longer in your system. Everything works better together. Japanese researchers studied 30,000 men for 13 years. Men who drank green tea daily had significantly lower rates of prostate enlargement. The compound blocks growth factors that tell prostate cells to multiply. Here is how to use it. 3 cups daily. Brew it properly. Heat water to just below boiling. Steep for 3 to 5 minutes. Drink it plain, with lemon, or cold over ice. Morning, afternoon, and evening. You can also use matcha powder in smoothies or mix it into yogurt. Now we move to number 2. This food fights the inflammation that makes your prostate swell. Number 2. Salmon. This is your anti-inflammatory foundation. Salmon contains omega-3 fatty acids. These fats reduce inflammation throughout your body, including your prostate. Remember that swelling I mentioned? Omega-3s bring it down. A UCLA study followed 380 men with enlarged prostates for 6 months. Men who ate fatty fish twice weekly showed 32% improvement in urinary symptoms compared to men who did not. The omega-3s reduced prostate inflammation measurably on ultrasound. Here is how to use it. Wild-caught salmon twice weekly, 4 to 6 ounces per serving. Bake it with lemon and herbs. Grill it with olive oil and garlic. Add it to salads. Make salmon patties. Use canned salmon in pasta or on crackers. You can also eat sardines, mackerel, or herring, all high in omega-3s. Now we reach number 1. This food has the strongest research backing for actually shrinking prostate tissue. Number 1. Avocados. Here is why this food ranks highest. Avocados contain more beta-sitosterol than any common food you can buy. More than pumpkin seeds. More than supplements. Beta-sitosterol blocks the conversion of testosterone into that growth hormone we discussed earlier. It also reduces inflammation and promotes the natural death of excess prostate cells. Mayo Clinic research showed men with high beta-sitosterol intake had prostates that measured 17% smaller on ultrasound after 12 weeks. 17%. That is measurable shrinkage. Here is how to use them. 1 avocado daily. Eat it plain with salt and pepper. Slice it on eggs or chicken. Blend it into smoothies. Mash it for guacamole. Add it to salads or sandwiches. The fat in avocados also helps your body absorb the lycopene from tomatoes better. Now you know all 5 foods. Before I give you the complete protocol, there are important safety considerations you need to understand. Before you start, there are a few important safety considerations. These 5 foods are natural and generally safe, but you need to know this information. If you take blood-thinning medications like warfarin, talk to your doctor before increasing green tea, salmon, or avocados. They affect blood clotting. Not dangerously, but your doctor may need to adjust your medication dosage. If you have acid reflux or heartburn, start slowly with tomatoes. The acidity can trigger symptoms in some men. Cook them well and eat them with other foods to minimize this. Avocados and pumpkin seeds are calorie-dense. If you are watching your weight, account for them in your daily intake. 1 avocado has about 240 calories. A quarter cup of pumpkin seeds has about 180. Allergies are rare but possible. If you experience any unusual reactions, stop that food and consult your physician. Now you have all 5 foods and the safety information. Let me show you what to expect and how to start today. Here's what to expect. Most men notice better sleep within 3 to 4 weeks because bathroom trips decrease. Urinary flow improves around week 6. Measurable prostate shrinkage happens between 8 to 12 weeks. Stay consistent. These foods work together over time. Work with your doctor. These foods support your treatment. They do not replace medical care. Get regular checkups. Monitor your progress. You now have a proven protocol based on real research. 5 foods. Specific amounts. Clear timeline. This is your opportunity to take control of your prostate health naturally. If this video helped you, hit that like button. Subscribe for more evidence-based men's health content. Your prostate will thank you.